Hi, my name is Caitlin. I'm a social worker here at the HIV clinic in Bowling Green. A brief overview of my client case is Jacqueline. She is a 32-year-old female that came to our clinic for intake to care. She was diagnosed with HIV at a hospital after a SANE exam. She was sexually assaulted at a party after she had been drugged. And upon going to the hospital for a rape kit, which is also called a SANE exam, she was diagnosed with HIV and they referred her to our clinic for care. So, this was her formal interview for intake assessment, and we went over what she needed, what she could get from us, her future plans, her goals, what we could do for her to help reach her goals, and things like that. The first step was obviously to confirm her diagnosis with a test the following day, and then some longer term goals were to have her follow up in 10 weeks for a second test just to confirm that her body is making antibodies to the HIV virus, and then link her to services such as mental health therapy for her trauma, couples counseling because she's struggling with her partner after the rape, and things like that. So that's just a very brief overview of our 20-minute interview. And going into the questions, one human behavior theory that helped me in this interview and dealing with this client is the systems theory, because this one action of sexual assault impacted Jacqueline and her whole system. So the one part of her impacted everything around her. Her sexual assault and her diagnosis both had ripple effects on her entire system. So she was kicked out after her diagnosis because her roommate didn't want to catch HIV from her, which is a different discussion, but so she lost her housing. Her relationship is struggling because it's a whole adjustment to deal with post rape trauma and stressors in the relationship, as well as adjusting to a diagnosis that is probably scary for both the patient living with HIV as well as the partner who is new to adjusting to the whole thing. So she's going through a whole like meso relationship kind of struggle. She's confused about like what it means for her and where does she go from here? Where can she find support for it? So, the systems theory really helped me work through that. So, this one part of her life has an impact on everything around her, everyone around her. One potential ethical issue I could have run into and didn't is if she had not disclosed her status to her partner. We had a similar discussion previously earlier in the semester, and this could have been a real life situation with this client if she had not told him. It could have been an ethical issue if I felt like morally obligated to tell her that I needed to tell him. I wouldn't have felt that way because I'm serving her, but it could have been an issue hypothetically if I had moral ties that led me to believe that I should tell him that he was at risk because his partner was HIV positive. But because she told me that he knew her status after her exam and she'd already talked to him about it, we avoided that potential ethical dilemma. So, what I would have done if she had not told him yet is simply encouraged her to tell him and then bid a support system if she needed me to when she was telling him. I could have also volunteered to coordinate like therapy services for that discussion, to help walk them through the discussion if she didn't feel comfortable doing it by herself or didn't know what to say because that's a sensitive issue. So that could have been an ethical issue if it had come up differently than it did. Something I wish I had done differently with the client is focus more on her diagnosis instead of what she needed. A lot of the interview was more about what we could do for her, what we should do for her, what we are going to do for her, and not so much about her education of HIV. Simply because, hypothetically, if this was a real life client, that would come naturally after they were taken into care. So, being that this was just her assessment and intake, I didn't think about going into detail about her diagnosis, especially before we had confirmed it with our clinic. And I wish I had just gone more into detail, because our interview was focused a lot on like what she wants, what she needs, practical things such as housing, food, mental health services, tests, medical appointments, things like that, which are all practical and what she does need. But I wish I had asked more questions like, do you understand your diagnosis? Do you feel things about your diagnosis that I can help you work through? What do you know about HIV that I can help like reassure you with, or confirm that that's true, or tell you otherwise if it's not? Things like that, because in real life, if that had been a real interview, I would have felt guilty if a client walked away from the interview and still had questions about their diagnosis that I didn't answer. So I wish I had taken a little bit more time to discuss the true issue, which is the diagnosis of HIV. That was my biggest criticism of myself during the interview, is that I wish I had taken more time to discuss the actual HIV diagnosis. But I also did know that upon her being formally taken into care, that would have been a conversation to have later. So that's basically it. I based this interview on my personal knowledge of the subject, because I'm actually an HIV health educator at a clinic in Bowling Green. That's what I do full time. So it was helpful to use my natural skills and education in this interview, and it really is more common and more needed that we have these discussions and these types of interviews with people about what we can do for them, instead of just preaching at them and talking to them and talking at them instead of having conversations. So I wish I had more of a better like back and forth conversation about her diagnosis, instead of just, what can I do? What can I do? What do you need? So that is something that I'm going to work on moving forward in the future, especially when we get to real life interviews. Thanks you guys for watching, and leave me some feedback on what you thought.